There are many institutions training students to be health workers, especially nurses. Some of these institutions are training colleges or universities owned by the government, and others are private owned. Is there a difference between a government-trained nurse or a private one? Or is it true that most nurses trained from the private institutions find it difficult to be employed by the government? After the break, we'll find the answers to these questions and many more as my crew follows me to my alma mater, Wisconsin International University. I'm Rina, and I'll be right back. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Welcome back, viewers. I'm so happy to be back in my school today. Not as a student though, but I'm hosting this brilliant woman. She's the faculty administrator of the School of Nursing, Wisconsin International University, and she's in the person of Mrs. Olivia Acheampong. Thank you for having us in your office, Mrs. Olivia.
Thank you too.
How are you doing today?
I'm very well, thank you.
Madam Olivia, please tell us briefly history about Wisconsin International University.
Okay, thank you. Wisconsin International University has been in the system for the past 20 years. The university started with the master's program, MBA, and then later on added some undergraduate programs. Yes, and School of Nursing joined the train or came on board in 2015, 2016.
Oh, okay.
Yes, and by middle of 2016, we were done with all accreditation processes, and we had our first batch of nursing students.
That's nice. Yes. So aside nursing, what other programs do you guys offer in
Okay, as we started in 2016 with general nursing, by 2017 we had added on Bachelor of Science in Community Health Nursing and Bachelor of Science in Midwifery.
Okay.
So currently we have Bachelor of Science Nursing, Bachelor of Science Community Health Nursing, and Bachelor of Science in Midwifery.
That's quite a good. I mean, within the period that you've had,
yes,
you've managed to come up with all these programs. Yes. It's very good. So, what are the expected requirements for someone who wants to enroll in any of these programs?
Okay. It depends on what the person is applying with.
Okay.
We admit WASI candidate applicants. I mean, if
fresh from high school,
and then we also admit some serving officers,
okay,
nurses and midwives, and then so depending if you qualify, yes, WASI has its own qualifications that we look at. Then those with the nursing certificate also have their own qualification that we look at.
Oh, okay.
Yes.
So those who are practicing as nurses or midwives can actually come here and then have their top-up programs to do
yes,
BSc.
Those who are practicing already, yes, we have the auxiliaries, we have the HAC, NAC, and NAP, those who have certificates in nursing, certificates in community health nursing. They come through an access course. Anyway.
Oh, okay.
So because the certificate, the NMC certificate they have, it's not up to what will let them come to do the straight BSc. Okay. So we have the access course for them. They write examination, and then successful applicants are admitted, yes, into the BSc nursing or community or even midwifery. And then with midwifery too, we have the post basics. They have done the HAC, NAC or NAP, and have gone ahead to do midwifery.
Okay.
So they are the post-basic midwives. We admit them as well. They also have NMC certificates. So that's what we admit them with. And then we have our diploma holders, the diploma nurses, diploma midwives, and yes, the diploma community health nurses. We admit them as well. So it depends. With the serving officers, we need to see your nursing and midwifery council certificates.
Okay,
and
to prove
so, yes,
that.
to prove.
Yeah.
And that is what we admit you with.
Okay.
Otherwise, even if you've done first degree, second degree, whatever, and it's not in nursing, we check your WASI results or SSC results for that matter.
Oh,
A few times we have had to admit O-level and A-level students.
Wow.
Yes.
That's a fantastic thing. What was the application process for the students who want to enroll?
Okay, so you first apply by purchasing the form, the application form, and then as you submit, you add your certificates, whatever. If you are WASI, you add your result slip. Yes. And so if you qualify with WASI, you need 6 credits, and you need to have read science, general arts, or home economics.
Okay.
Yes. And so you have 6 credits, including English, Maths, and Science, and then your 3 electives. Yes, and you're good to go. If you are HAC, NAC, and NAP, your NMC certificates. Yeah, post-basic. And we have the SRNs. The SRNs were those in the system before the diploma. So you have the SRNs as well, state-registered nurses. Yes, okay. We admit them as well.
Oh, okay, all right. Then with the, you mentioned that they need to buy the application form.
Yes, so
is it online, or do they have to come to the school?
Okay, yeah, you could do it online, depending on where you are. You could buy it online, and you could also come to the school to buy the form. Yes, so once you fill, you could buy it outside the school, fill and upload your certificates, everything. Yes, and then we would let you know. If sometimes, if there is a document that is missing, we contact you.
Okay.
Yes, we contact you for you to know. So we screen everything, all admissions. We screen them, and then if for some reason we are not even admitting you, we call you for you to know.
That's nice. Yes. And it's a nice way of letting the person go.
Sometimes we need to advise them, especially those who have deficiencies in certain areas like mathematics, English. You just need to talk to them. You just need to reassure them or give them other options, because if the person doesn't really want to sit for the WASI anymore, the person could be advised to go do the certificate as a HAC or NAC, and then
reapply.
Reapply.
Oh, okay.
Then through the access course. So we actually talk to all of them.
That's good.
Yes, we talk to them.
I mean, it's good that you're encouraging them and to actually call the person that, oh, you can do it this way and still come back. I think it's a good thing.
Yes, because we realize they really have the the zeal to be nurses. Sometimes they're lost. They don't know. They're not too sure. Okay, so it will be a bit inappropriate to just say you don't qualify. You didn't get maths, so you don't qualify. No, we talk to them. Even those who read visual arts, that we do business and visual arts. We do not. The Nursing and Midwifery Council doesn't accept most of their courses. Yeah. So we get them. We have some visual arts students who have actually gone to read certain courses, subjects that are accepted, and they have come back to us.
Wow.
Yes. So if you're able to talk to the student, the prospective students, or even the parents or guardian, yes, they go, they read, and they come back. And we have a remedial school, so sometimes
right here in Wisconsin.
Right here in Wisconsin.
Oh, okay.
So sometimes they just enroll
there.
And before you realize, they are here to pursue their
pursue their dream.
Yes.
That's a good thing for Wisconsin is
so
doing.
if you qualify, then we give you an admission letter, call you, let you know where we are placing you, especially the serving officers. If you are a midwife coming to read nursing, or you are a nurse and coming to read midwifery, I mean, what you expect to get, you may not, because sometimes when you're diverting, instead of probably you expecting that you're put in level 200, you could be put in level 300, level 100, or vice versa.
Oh, okay.
Yeah. So we call them to let them know where we're putting them and the reason why we're putting them there.
It's getting interesting, viewers, and I would like to continue, but please bear with me. I have to take a quick break and acknowledge our incredible sponsors. I'll be right back. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Welcome back, viewers, and I'm still in Madam Olivia's office. We are just getting started. Madam Olivia, please, is there a difference between the curriculum that you have in the nursing institutions the private nursing institutions, and that of the nursing training colleges?
Okay, if you say private nursing institutions, we have other private nursing institutions, but we are, tertiary. Okay, for other tertiary institutions that are offering degree in nursing and nursing related courses, no, they are basically the same. For the training college, comparing the curriculum of training college to that of the tertiary, that is for Wisconsin, for instance, I must say it is same but not the same.
Okay.
The same in the sense that we are going according to the requirements of the Nursing and Midwifery Council. So with this, let me take the curriculum for the diploma level in the training college. The curriculum for what the NMC requires is the same thing of them, is the same thing that NMC requires of us as we train degree holders. So for instance, the main nursing courses like anatomy, physiology, pharmacology, therapeutics, pharmacovigilance, medical nursing, surgical nursing, and the rest, yes, they also read them.
Okay.
They also read them. The main difference is that the main difference, I must say, is the complexity or the depth that the degree tuition would go.
Okay.
I mean, it goes deeper than the diploma would go, even with those ones that is required of all of us. They all write the same licensing examination, use the same green book. Okay, yes, from NMC green book or any other color for the other programs. But with the university also, we have other courses, the research methods, logic and critical thinking. Those are the university-wide courses. For Wisconsin, for instance, nurses read French, sign language, entrepreneurship, a lot that adds up to the fulfillment of the BSc degree certificate. So that is what puts the degree holder ahead of the diploma holder. Okay, apart from that, even when they step out of school, the diploma holder would wear a different uniform. The degree holder would also wear a different uniform. And the positions out there, the ranks out there, A degree holder goes out straight and they are nurse officers.
Mm-hmm.
A diploma holder will be a staff nurse before rising through the ranks, and some 6 to 10 years before they get to that rank. And that is why if for a diploma holder to become a nurse officer or to get a degree, they have to come for a top-up. So you see, it is same but not same. If you look at the NMC requirement, then yes, we are studying the same thing. But the difference is when they go out there and they are performing.
Okay.
Yes. So that, for instance, let me give you a scenario.
Okay.
If a diploma holder or a staff nurse, for that matter, is taking care of a patient.
Yeah.
Okay. The patient comes, I have headache. Okay. If they would just pick paracetamol because that is what we give for headache, and give, the nurse officer comes in, and what do? They add rationale. Have you checked the folder? Have you checked the patient's history? Do you know whether the person is allergic to this or that?
Yeah.
That is how it comes in. And you realize that this person in academics has gone far.
Yeah.
Yes.
Yeah.
So
there's definitely a difference from what you've said. Okay. And what are some of the extra curriculum activities that you offer the students here so that they will be impactful in society?
Oh, well, we started, we let them experience it here. We normally have outreach programs, the community, free screening exercises that when they come around, it's only our students that take care of them. We don't invite any nurse from anywhere. We don't invite any medical doctor from anywhere. Our nurses take care of them, and they will check, they screen and also advise.
Okay.
And even, yes, counsel most of them. So, and then sometimes too, they go out there, you could see our nursing students clean the environment, clean the, Wisconsin area and even beyond. And this is to let them know, also, let them know that the nursing is serving. It's a service. Yes. So you don't just come and study your books and go. Okay. How are you going to kind of help society aside from you looking at it as your profession? Yes. So we impart that in them. The counseling aspect especially. And our doors are always opened. The community around, people around could walk in anytime and ask us any questions. Even our lecturers are there. The high percentage of our lecturers are nurses. So yes.
You mentioned that the students get hands-on practice while they are in school. For instance, the screening that they do. But don't you think that you put the school in kind of liable to any medical situation or complications if students end up doing screening and advising patients or clients, and it probably doesn't go well since they are students and they don't even have the license yet?
It's they don't really go into treating, that's giving medication. They don't prescribe. They advise.
All right.
They advise. So if they check your vitals, and your BP is high, a student should
know
be
the
able
normal
to,
BP.
yes. So they tell you your BP is high. Maybe you have to see your doctor. They check your blood sugar and it's high. They tell you have to see your doctor.
Oh, okay.
Okay, so they screen your eyes and everything. So they don't give treatment.
Okay.
They don't give treatment. They just tell you what to do.
Okay.
And yes, it's helping. And they don't just do it. They do it with the lecturers around.
Okay.
Our senior nurses, the lecturers here, we have principal nursing officers, we have DDNs, we have matrons. So they are there. They are always there. Yes,
supervisors.
to supervise.
Oh,
Yes.
okay, all right. What are some of the advantages that nursing students from Wisconsin International School have over other schools? Just to encourage people who are watching and they would want to.
Advantages. I would start by saying the basis. The basis. They have a lot of advantages, but the basis is that Wisconsin International University College doesn't compromise on quality. So it wouldn't even go for only nursing students. Every student in Wisconsin has an advantage, or has lots of advantages over the other students in other universities. For instance, let me take our nursing students. You see, education or tertiary education, the main thing is faculty. And talking about our faculty, we have highly qualified lecturers. Like I said before, the highest percentage of our faculty members are nurses. These are people who have the nursing at their fingertips. So if they're training you, you know where you're heading. Yes, and you know our dean, Dr. Acheampong, yes, has PhD in nursing. And if she was out there in the hospital, DDNS, or even
Head of
Ghana Health Service, yes, she would be on board. So if you have a board member teaching you, you can imagine. We have principal nursing officers. We have, go to the skills lab. Our skills lab is a whole department on its own. Even when we had 6 students, we started with 6 students. Even when we had the 6 students, we had all these facilities. We didn't look at numbers. We didn't look at the fact that the school fees may not meet what we, no. Everything was there. The libraries, specifically for nursing, and big library, and even the equipment we have in the skills lab. Everything. What students are experiencing here, it's difficult to get it out there. Honestly, it's difficult to get it out there. What don't we have at the skills lab? Everything from even ECG machines, and then we have
ECG machines at the skills lab.
Yes, we have dummies that you could try them on, that they would respond.
Whoa!
Yes,
there are hospitals that don't even have ECG machines.
We have them. We have other machines. We have pulse oximeters and all that, and they work on dummies. Dummies that could respond to pain. I mean, yes. You give them injection and they respond.
That's a modern skills lab.
Yes, ultra modern skills lab. We have labor bed for our midwives. We have pregnant dummies. We have a lot. We have a lot. So you step out of here a nurse, a very quality one. Yes. So yes, looking at what we have, yes. It's a great advantage. Those who are not in Wisconsin are missing out.
I'm sure they can hear you.
Yes. For a skills lab to have ultrasound machine, yes.
And dummies that respond to all.
Dummies that respond to all of them. And we have a team. You see, in Wisconsin, it's not as if somebody teaches you basic nursing and would have to follow you to the skills lab. No, we have instructors. We have clinical instructors. Even when they were just 6, we had a senior clinical instructor. Now we have clinical instructors led by a principal clinical instructor, and they're doing a good job. Marvelous. If you go to the skills lab, yes, it's a hospital setting. It's a hospital setting. So our students are in, let me say, they're in a comfortable mood.
I like that. Is it true that most private nursing trained students find it very difficult to get employed after school?
No, not at all. Private or public, except those who have the licensure certificates already that do not need to sit for NMC exams again. I'm talking about the diploma holders, the post-basics, the SRNs. The HACNAC and the generics. The generics are those who come straight from SS.
Yeah.
They all write the licensing examination. And NMC, once you pass the licensing examination, they are going to post you for national service or let's say rotation. Okay. And it's not for only public schools. It's for private, public, whoever has met the requirements of the National Midwifery Council and has sat for the examination and passed. So after the rotation, everybody applies. The time when Ghana Health Service would post nursing students, graduates to stations is no more. You apply. So you attended public university, you attended private university, you all apply. I don't think it's true that private
trained nurses
find it difficult to get jobs. And also, it's not everybody who wants to work with Ghana Health Service or public facility. So with your degree, you could go to any facility and then nobody will ask you to go away because you attended a private university. No. So the National Midwifery Council treats them equally. Yes.
Oh, okay. Well, let's talk about the ward a little bit. We all know that sometimes we have repulsive nurses in the system. They've gone through the training and everything, but their attitude is just repulsive on the ward. Is it that when they are in school, those things are not checked, or they are not checked, or they hide it well and it's not seen?
Well, let me say it depends on the individual. And it partly depends on the facility where they're working as well. And for us, as a nursing institution, as I said, we have a clinical team and they take care of all that. And our students do professional adjustments. Even before that, students we keep counseling them, talking to them, how to comport yourself as a nurse, how to go about your work. And their lecturers are nurses. So, yes. And so, even if the person wouldn't exhibit that here, even if they have it inwardly, it will change before they get out of school. So, the problem may be, societal, probably where the person is coming from and where the person going to work, what the person goes through. Sometimes you wake up in the morning and it's just not a good day. And then also sometimes the facility, the pressure. A lot of facilities have less number of nurses taking care of a lot of patients. So if the person is tired, they're tired. I mean, it happens. But for training, we do our best. We do our best, I can assure you.
I mean, I've heard a lot, and I know definitely with the kind of skilled lecturers that you have and all those things.
Yes, we do our best.
The nurses that are coming from Wisconsin are awesome.
Awesome.
Madam Olivia, just a final question. Nursing, the topic that we are discussing is nursing is more of a ministry than it is as a profession. What would you say about this topic?
More of a ministry than it is as a profession. Well, so we accept that nursing is a profession. It is a profession within the health sector. And focuses on care for the individual, families, and community. So they may attain or even maintain or recover optimal health and quality life. Yes, that is the basis. But I also see the vital part of nursing as a ministry. A ministry in the sense that the profession calls them to serve. The profession calls them to serve. So it is a profession, and it is also a ministry, because a nurse takes care of a person holistically.
Yeah.
You don't, somebody comes to you physically, they're sick. Sometimes spiritually too, they're sick.
Yeah.
So you treat them physically and they're still not well.
Yeah.
You go ahead and then treat, advise, or reassure. Those are the things we ask of our pastors anyway.
Yes.
So most of the caring activities of nurses are pastoral in nature. Yes, and for instance, now we have the patient-centeredness. I don't know if you've heard that it's a requirement from Ghana Health Service.
Okay.
Right? Yes, you give, every nurse, every clinician gives patient-centered care. You treat the patient with respect, dignity, and also you involve the patient in the treatment. How are you going to involve the patient in the treatment? If you're telling the patient, I'm giving you lorazepam so you could maybe sleep. Why are you giving it to me for me to go and sleep?
Yeah.
Okay.
Yeah.
And then what is wrong with me? Okay. So you have to explain all that, and you explaining, sometimes they get their healing.
Because mentally.
Yes, they get their healing.
Yeah.
So you're looking at the mental, you're looking at the spiritual, and then physical. So yes, nursing is a profession.
Okay.
But it is indeed a ministry. That is how I see it.
Yeah.
I see it. That's how I see it. Because if you reassure somebody, or even if you reassure a mother who is carrying a baby, you know, automatically the mother is fine, baby is fine, because then they get to know what is going on.
Yeah.
Yes, unlike you just saying, okay, you came here for treatment, I've given you an injection, go. Okay, that one we wouldn't call it a ministry. We wouldn't call it a ministry. You advising, you talking to them.
Yeah.
It's very important. So that is how I see today's nurse.
Madam Olivia, what advice will you give to viewers who aspire to be nurses?
Okay, let me first congratulate anybody who wants to become a nurse. It is a very good decision. It is, I mean, you are moving into a very noble profession.
Yeah.
Yes. And my advice is that they keep on going on. They keep, you know, pushing till they get there.
Yeah.
And then also, we are in an era that every home, I can assure you, every home needs at least a nurse.
Wow.
Yes. How do you feel, even knowing that your next door is a nurse?
Yeah.
Your next door neighbor is a nurse.
Yeah.
Yes. So every home needs a nurse. So it is a good move if you want to be a nurse. And I would say just keep on pushing till you get there. And then they should aspire to be degree nurses. It's very important, because very soon, everybody will have to get their degree as a nurse, because that is what will let you rise through the ranks well and get to, if you are a diploma nurse, you can go.
Yeah.
But just to PNO, and you are there. You want to become a matron, you want to become DDNS, you need a degree, because you have to do your masters.
Yeah.
Okay.
Yeah.
So I'll congratulate them for thinking nursing, and then also encourage them to come to Wisconsin to experience good nursing.
Thank you so much, Madam
You're
Olivia.
welcome.
Thank you so much for having us in your office.
Thank you. Thank you for having me too.
in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. Phatex Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Health in the Spotlight is all about putting health in the limelight, bringing to your screen interviews and stories that will broaden your mind on health matters and inspire you to be who you want to be. The novelty of some of these stories for this particular season have been quite sentimental, and I'm grateful to all our guests for choosing our talk show to share their story. Viewers, I know you've been educated and you've enjoyed all the episodes. I urge you to please subscribe and click on the bell. There are many interesting topics coming up that you don't want to miss. I'm Rina, and thanks for watching.